Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you a few minutes about a total crossbite on the lower left side. The lower left molars down there were completely missing the upper molars, and we're going to expand this arch on one side only. And a lot of people don't realize what you have to do to spread an arch one side and leave the other side alone, or it looks like you leave it alone. You correct it. I hope you'll be able to hear me and understand what I'm saying. And I'm sorry for this crossbite, but I have to get on with this deal. So we're going to start, and okay. All right, here's the young man. When you look at him, you can't tell this at all. His face looks perfectly normal on both sides. But on the left side, these lower teeth miss the upper teeth. And let me show that. And a lot of people don't understand how you can expand one side and not expand the other. Or it looks like you don't expand the other, but actually you do to a certain extent. So you have to pit both sides of the upper arch and the sides that's correct on the lower arch. In other words, this quadrant up here, and this quadrant, and this quadrant, maybe I should say, correct one quadrant by bucking it against the 3/4 of the mouth, and you bring it across that way. And a lot of people don't understand how to do that. Now, if you look at it right here, it looks perfectly normal. But when you look at him closer, you will see that these teeth over here, actually his molars miss the upper teeth. In other words, you'll have the upper teeth kind of like this, and the lower tooth will be sitting kind of this way. And he's missing it. And sometimes they call it a scissor bite, because the teeth go down like a pair of scissors here. And you've got to bring this side out, and this side over here, it was correct. The upper teeth would be like that, the lower teeth fitting in here. And we want to expand this in this direction. We want to bring these teeth out, and we don't want them to change this over on this side. So we're going to pit this quadrant and this quadrant over here, both upper quadrants, and the back lower left, lower right quadrant. We're going to pit them against this part and make it go out and not mess up this relation here, right there. And so we do this. You have to, if this completely locks under, you have to put a block in here to get it over. I think on this case we just pulled it over, but it would work easier if you bonded something to slide it over that way. Okay, let's get going with this, and I'll show the models in a minute. This side is correct. That's class 1. This is have to be pull that cuspid down in there, the lateral work. There's some other things that go wrong with this case, but we'll correct them all at one time as we get in here. Now, I'm going to go to the next slide, and so the upper, we're going to push it out, and this will go out, and this will come forward some to correct this. Now, the bottom arch, the exposures, it's these teeth over here. We're going to carry them out, and the upper teeth kind of come in like this. They almost miss them here. Now, I don't think we had to bond a block, but on a deeper one like this, you would bond this to raise it up so you could slide it over much easier. Excuse me. Okay, let's get going, and I'll show it to you on the models. Now we had to move the start case in 4 of 89. We started the case. Now these teeth are missing this. We didn't have to bond block there, just close enough where we could pull all of these teeth out in this direction. That'd be going this direction. And these teeth, we'll be pushing them back in this other direction. And these over here would be going same way, and the bottom ones would be going the same way too. All right. We put the large arch wire in here, and you'd have to put some buccal root torque, except if these teeth are leaning in this direction, you can straighten them up without the buccal root torque. So here we're expanding this with a lower Big Daddy arch. And this pushes these teeth out here, and it pushes exactly the same on these teeth over here. But we don't want to move these teeth, or we want to keep this relationship going. And so we have to come in and use some elastic here to keep this from moving. So as we push these teeth out, it's getting the same force over here. We don't want this relation to change. So we put elastic back on the molars going. This is on the inside. Well, it'd be coming back and putting rubber bands like that. On this side, on the inside, we put the rubber bands out, and going back over here. So the rubber bands are pushing these teeth out, and they're pushing these teeth in and pushing these teeth out over here. Now, as we push this over in this direction, we don't want this bottom to move out, so the rubber band holds that tooth in that position. It pulls out on this, and this is being pushed out. So this will move a little bit, but you don't see that movement in there. This will not expand. It may do a little bit of deep, but you don't notice it. And we're playing this quadrant and this quadrant against this quadrant here, and this will move out and the other one won't. Now I want to explain that so everybody that looks at this, even an individual who's not a dentist, ought to know how to do this. Or if there's something wrong in your mouth, they don't have to mess up. They can move one side out if they know how to do it. So let's go ahead now, and I'm going to erase this, and you can see that go out. All right, we put that in there. Now, these are the rubber bands. They go from the lingual to the buccal down here. Though they look like they're almost the same place, but they're further back in the mouth, back here. Now, his is a class 2 elastic that's pulling these teeth forward to correct the class 2 relation that's really over on the other side. This rubber band now is pulling, so it's pulling upper in this direction, and when the mouth's closed, it'll be like that. And now the Big Daddy arch is going out on both sides, and as it goes out with this, these elastics are pushing this way. So this will move out, and this will move out, but it'll be the same way. You watch it, and it'll go the same way. You put the pressure on there enough. And now this will go out, and this one will go in, and you will correct this bite. Now I'm going to erase that, and you can see that go. All right. On one side, the left side now will be corrected that. This is the large arch wire. We built it to fit. You make it fit, and then you spread this wire out that much. That's about a ½ inch on both sides. You tie one side over here, and now this one will be twice as far out over here. And now you can push a Doctrix gauge against that and tell exactly how many ounces of force you're using to bring these teeth out. And then you'll have a certain amount going out over here and a certain amount on these right here going out, and you will be pushing, you will be sucking this in by a hook here going out and hooking the upper teeth, and it'll be pulling the upper teeth in that direction and the lower teeth in this direction. Now that's going to get some people mixed up. So these 3/4, the two uppers and this lower over here, will play against this right here, and we're going to move this out. It'll be the one to move. Now I'll erase that, and you can follow that. All right, here we go. We've got the class 2 corrected, or we brought the anterior teeth in, and we kept the class 2 over here. This was the class 1 side, and this is 1 of 90. All right, here now, these lower teeth were over here missing, so they have moved way out over here. These moved out a little bit, and the uppers moved a little bit, and we kept the relationship here, and we established the new relationship with these. Let's see, we don't want to, yeah, they'd come down and come up on this side over here. So this would be fitting that way. This would fit in the deal like that. And now this corrects. Let's go look at it. All right, here we take these crossbite elastics off, and you can see this side now, the lower teeth are fitting under here, and the upper teeth are coming down in there and fitting out here and hold the cheek away from the teeth. Now, you can see the lower arch, if you compare it with what it was. These meet correctly, and these over here meet correctly. Now, if they had been a little deeper, I would have had to bond a block on this side to carry this across. But I didn't, so I didn't bond the block. So I'm going to call that a bonded block case anyway. Now this is a distortion. This right here, this actually goes over there. So there the lower is. These teeth were fitting up against these teeth. So these teeth have moved about a ½ inch in here to get to the place, the right place. Now they didn't move all that far because this moved over a portion of that, but we brought these together, and then both sides over here moved the same amount. And that's the distortion, I'm sorry. Now here we go. That's 4 of 90, and we have this widened out. Now these teeth are meeting like that, whereas they were not before, and we corrected a class 2 relation over on both sides. And now this is meeting, got the lower teeth corrected, class 2 corrected, and it was class 2 on the other side. I think I said it was corrected when I started. I missed out on that. And here the young man is with these teeth meeting on both sides of the mouth, and we did that with the pressure. In other words, we pitted a quadrant here, and this right here against this, and we kept on going by using elastics, doing like that. And I hope I explained that where people will understand it. So if you have this type of bite, you take this to somebody. If they don't know how to do that, it'll show them how. So thank you for watching, and I'm going to hang up here, and I'll get back in with you later on. Thank you now.